Roadhouse. I want to introduce you to my patient, Russ Glenn. Russ had neck, upper back, and shoulder pain. And why don't you talk a little bit about, where you were before you came in, how long you had it, and what kind of treatment that you tried.
I had my neck hurt all the time, and for the longest time I thought it was just neck pain. And it went on for about 2 years after a little accident. I finally realized that it was more in my shoulder. I was seeing another chiropractor. I'd been to my primary care doctor, and the other chiropractor recommended I come see you. He said you had specialized equipment for those type of injuries, and so I did that, and I was pleasantly surprised when the first visit we got some of it out.
Yeah.
And it's just been a few weeks now, and I feel like I'm so close to normal. I worked and played all weekend without any pain at all.
Yeah. Well, really can't say much more than that, right? So, you've had a problem for quite some time, and you went to your family doctor, and it didn't really help. You went to chiropractor, not much relief, and then you went to another chiropractor, and you got some relief, but it was still not. You still had some residual pain and into the arm and the shoulder.
Yes, I thought I had permanent arthritis because
Yeah.
it was going down my arm and
into your
my
thumb, right? Yeah.
And I thought it was arthritis. My primary care practitioner even told me, at your age, you probably just have arthritis. And I just figured I was going to have to live with it the rest of my life. But it's, it's all gone.
I hate that when they go at your age. You know
At your
what I mean?
age. At your
Well,
age.
it's the same age as that arm right there, and there's
It's
no
it,
problem.
it is.
there.
There's no problem with it.
Yeah. So you're doing a lot better, and the neck pain and all that is gone, and you're doing a lot better, and you're just able to do more. You were telling me about this weekend that you did quite a bit.
I worked all weekend, but I wasn't. For a year, I didn't sleep more than a couple hours at a time. I'd wake up in pain. I was taking ibuprofen and aspirin and Tylenol and hot packing and cold packing, and never slept more than a couple hours at a time. 5 hours a night was about my limit.
Mm-hmm.
And now I lay down, I go to sleep. I sleep 7 hours and have to get up and could probably go for 10. So.
Well, we have noticed that you're smiling and in a much better mood than when you first came in, and that's what happens when you feel good, and when you sleep is when you heal, and now you're sleeping and stuff, so good.
And I usually try to, keep a positive outlook no matter what, but it was really, getting me down.
Mm-hmm. Yeah. Well, good. Well, I'm glad you had such good experience at our office, and might want to thank your wife because she did refer you in.
Yes.
Also,
And the masseuse that she was seeing that referred her. Yes,
right. Yeah.
We're both very pleased. So
well, I appreciate you doing it, because there's a lot of people out there just like you that thought maybe you had arthritis or you had to live with it, and maybe they tried some other treatments and then they kind of gave up, but you didn't give up, and you're seeing the fruits of your labor now.
the biggest thing that I found was that it's so gentle. What you do is so gentle. Other chiropractors I've been to in the past, it was kind of really hard.
Mm-hmm.
It worked. It worked, but yours was so gentle and got more results.
Mm-hmm. Yeah.
So I wouldn't be scared to send my 92-year-old mother-in-law here. Because you don't even know.
Yeah, that's a good point. I appreciate it, because I learned a long time ago that if this is the only thing that's going to help them, chiropractic, and if you use a lot of force, that they might not come back because it was uncomfortable. So we're trying to train it to go back into place, and like you said, I did less, but you got more.
And the tables, they're you can't even feel it.
Yeah.
And it works. It works well.
Yeah. Thank you. All right, so if you're having a problem, maybe you want to do what Russ did and come in here and see if we can evaluate you, see if you're a candidate, and get the same kind of results that